the anatomy of the brachial plexus. Welcome to today's episode, where we'll be exploring one of the most fascinating and vital structures in human anatomy, the brachial plexus. In this podcast, we will take a guided journey, starting from the roots of the brachial plexus and following its path all the way to its terminal branches, highlighting its clinical relevance along the way. Let's begin with an overview. The brachial plexus is a highly intricate network of nerves that originates in the lower part of the neck and stretches into the armpit, or axilla. Its primary role is to provide movement and sensory feedback to the entire upper limb, with two exceptions: the trapezius muscle, which is supplied by the spinal accessory nerve, and a small patch of skin near the armpit, innervated by the intercostobrachial nerve. To help remember the main components of the brachial plexus, many use the phrase, "Really tired? Drink coffee." This stands for roots, trunks, divisions, cords, and branches. Now, let's break down the anatomy from proximal to distal. The first section is the roots. These roots are actually the anterior rami of the spinal nerves from the 5th, 6th, 7th, and 8th cervical vertebrae, as well as the first thoracic vertebra. You'll find them nestled in the posterior triangle of the neck, between the anterior and middle scalene muscles. The roots themselves receive sympathetic nerve fibers from the cervical ganglia, and two important nerves arise directly from them: the dorsal scapular nerve, which supplies the rhomboids, and the long thoracic nerve, which innervates the serratus anterior muscle. Next, the roots combine to form three trunks, which are located in the posterior part of the neck. The superior trunk is formed by the union of the 5th and 6th cervical roots. The middle trunk is simply a continuation of the 7th cervical root, while the inferior trunk is created by the joining of the 8th cervical and 1st thoracic roots. Of note, the suprascapular nerve, which supplies the supraspinatus and infraspinatus muscles, branches off from the superior trunk. The journey continues as each trunk divides into an anterior and a posterior division. These divisions are not named after any particular region, but their functions are significant. The anterior divisions supply the flexor and adductor muscles of the upper limb, while the posterior divisions supply the extensor and abductor muscles. This stage is crucial for organization, but no major nerves branch directly from the divisions themselves. Anatomically, these divisions are found behind the collarbone. After the divisions, we arrive at the cords of the brachial plexus. These cords are named based on their position relative to the second part of the axillary artery in the axilla. There are three cords. The lateral cord is formed by the anterior divisions of the superior and middle trunks, which correspond to the 5th, 6th, and 7th cervical roots. The posterior cord is created by the posterior divisions of all three trunks, incorporating fibers from the 5th cervical to the 1st thoracic roots. Lastly, the medial cord is formed by the anterior division of the inferior trunk, originating from the 8th cervical and 1st thoracic roots. Finally, the cords give rise to the 5 major terminal branches that supply the upper limb. From the lateral cord, the musculocutaneous nerve emerges and innervates the coracobrachialis, biceps brachii, and brachialis muscles, providing sensation to the lateral side of the forearm. The medial cord gives rise to the ulnar nerve, which supplies most of the small muscles in the hand, as well as the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. This nerve is responsible for sensation in the little finger and half of the ring finger. The median nerve, which is formed by contributions from both the lateral and medial cords, innervates most of the forearm flexor muscles, the muscles at the base of the thumb, and the lateral two lumbricals. It provides sensation to the thumb, index, middle, and half of the ring finger. The posterior cord gives rise to both the axillary and radial nerves. The axillary nerve supplies the deltoid and teres minor muscles and carries sensation from the skin over the outer upper arm. The radial nerve innervates all the extensor muscles of the arm and forearm and provides sensation to the back of the arm, forearm, and the back of the hand, especially over the thumb, index, and middle fingers. But the story does not end with these primary branches. Several collateral or pre-terminal branches arise along the way. From the roots, we have the dorsal scapular and long thoracic nerves. The suprascapular nerve branches from the superior trunk. From the cords, the lateral cord gives off the lateral pectoral nerve. The medial cord gives off the medial pectoral nerve as well as the medial cutaneous nerves of the arm and forearm. And the posterior cord gives off the upper and lower subscapular nerves and the thoracodorsal nerve. Clinical correlations are essential for understanding the significance of the brachial plexus. For example, Erb's palsy results from an injury to the superior trunk, most often the 5th and 6th cervical roots, and commonly occurs during a difficult birth or a fall on the shoulder. This condition presents as an arm that is adducted and internally rotated, with the forearm extended and pronated, a posture often referred to as the waiter's tip. Klumpke's palsy is a rarer injury affecting the inferior trunk, usually from a violent upward pull on the arm, leading to a claw-hand deformity because of the loss of ulnar nerve function. Crutch palsy arises from compression of the posterior cord in the axilla by a crutch, impacting the radial nerve. Saturday night palsy refers to radial nerve compression in the spiral groove of the humerus, and is known for causing wrist drop. Understanding the logical and sequential layout of the brachial plexus helps clinicians diagnose injuries and provides a framework for students and practitioners alike. Thanks for joining us on this anatomical journey through the brachial plexus. Stay tuned for more deep dives into the wonders of human anatomy. If you enjoy the content, please like, share and subscribe. It's the Everything Surgery Podcast. Dissect the extraordinary.